Girlfriend, welcome to the Hope After Breast Cancer podcast. I'm Jan James. We help women strengthen their bodies, renew their minds, and heal their hearts after a breast cancer diagnosis. Let's get started. I'm going to go off topic here for a second, but it's for a very good reason. Are you tired of paying high costs for healthcare coverage? Well, my husband Greg and I recently fired our medical insurance company and joined Christian Healthcare Ministries. Now we're saving almost $1,000 a month because of that decision. Hang with me for just a few seconds to see if CHM is right for your family. Christian Healthcare Ministries is a nonprofit health cost sharing ministry, not insurance. Christian Healthcare Ministries members have shared billions of dollars for medical bills while also keeping participation costs low for over 40 years. Some of the benefits, you can choose your own providers. There's no worry about a doctor being in or out of network. Who is it for? Christians who live a lifestyle consistent with CHM's statement of beliefs. It was totally consistent with what Greg and I believe. And guess what? Program costs are the same regardless of age, weight, health history, or geographical region. And CHM's ministry serves hundreds of thousands of members in all 50 states and internationally. Their program is great for missionaries and Christian organizations too. We found the application process to be quick and easy with no physical exams or medical paperwork. Christians can join anytime throughout the year, and membership can be effective immediately with no waiting period. You might be like us and are tired of paying crazy high costs for medical insurance. You might be a Christian business owner or a ministry leader like us who needs healthcare coverage. You might be a senior who wants to affordably supplement your Medicare coverage. We hope you'll check out CHM using our affiliate link in the description. And one last thing, by signing up for CHM with our affiliate link, you'll be supporting our efforts. And once you sign up, you'll be able to also get a link for CHM's generous affiliate program. Thanks for checking it out. Hi, everyone. It's Jan James from Hope After Breast Cancer, and I am so excited to have my friend, my doctor, she's a wonderful, wonderful treasure in my life, Dr. Melody Rodarte, here for 2 podcasts coming up. And this one, we're going to talk about something that most of us don't think about daily. So, Dr. Mel, how are you?
I'm good. How are you today?
Good. Hey, just for our podcast audience, would you tell everyone a little bit about your background and what you do for a living and how you fix people?
Sure. So I am a DO, which is a doctor of osteopathic medicine. I chose to go that route because I wanted to incorporate Eastern and Western medicine. That was important to me. I am double board certified. So I did internal medicine first, and then I went on to do obesity medicine, which is weight loss medicine, a fancy word for that. And then I also have certifications in hyperbaric medicine, wound care, and medical aesthetics. So that's me in a nutshell.
That is a big old mouthful, isn't it? You got lots of letters behind your name, right?
Yes. So I have finally landed in my own practice that I opened up in November of 2019.
Nice.
And get to do all that I do best under one roof. So that's where I'm at right now.
Really good. Would you call yourself an integrative medicine doctor?
Pretty much.
That's kind of the buzzword these days, right? So what does that incorporate? Is it just that it's looking at more solutions or more of the patient, or both?
I think it's root cause medicine. So it's more than just disease care. It's looking at is there a disease and what can we do to prevent? So integrative medicine is really looking at root cause. You might hear there's a little bit of fuzziness between functional medicine and integrative medicine, but in my opinion, they're both root cause. They just have different people started both of those societies. And so, but they have the same outlook of overall lifestyle, preventative medicine, not going to a medication first, not doing just disease care.
And, in my vernacular, maybe not just putting a Band-Aid on it, right?
Mhm.
Which is what I think we have really run into in so
Oh,
many
I
instances.
agree.
Yeah. So I threw you a curveball before this recording and said, gosh, don't you think we want to talk about inflammation? And thank you for agreeing to that. The reason why I wanted to pick that topic specifically is because we have thousands of women that we serve. Everybody's had a breast cancer diagnosis. That's what ties us together. But there are really two chronic things that seem to happen after a breast cancer diagnosis and treatment. One is often women complain about joint and muscle pain. The common thing I hear from everybody is, I'm only 50, but I feel like I'm 80. Oh my gosh, my feet are killing me when I get out of bed. It feels like I'm walking on Legos, those kinds of things. And then the second thing that I don't think we talk about enough is brain fog. But obviously, brain fog impacts us in every part of our lives. It's in the way we communicate with our families, with our coworkers. It's just the way that we process life. And these are medical issues that are, but going back to what you're talking about with root cause medicine, I love that we can talk about, well, what would be causing those things? Is it an inflammation issue?
So I think it is an inflammation issue. There's a cancer that's been diagnosed, and then depending on the treatment, we've done chemotherapy or we've done radiation or both. And then now most everyone is on, especially if you are receptor positive and you're on a medication called an AI or a SERM or something like that. We're blocking hormones. What has that done? It has created a menopause state and a reduction in hormones. And unfortunately, those hormones that were very protective of us aging. And so we've allowed ourselves to be in this age, we've made us menopausal when we treat it. And then we've created a lot of inflammation by either radiation therapy or chemotherapy. So we can recover quite quickly from the surgery. That's not the issue. It's what we've done to protect further development of the cancer, or like metastases, or we're treating metastatic cancer from the time of diagnosis. And so it is an inflammatory state. One, from the cancer, and two, from the medications that were made to help us survive, to let us survive. So this is where I'll say medicine is great. We have medications to help us survive, but we haven't been great at what we do to protect the body and help the body heal from this and deal with the effects of what we're doing, to survive. That was a long and short answer of it.
No, that's okay. But, so, I think in our community, we talk about that you get put on a medication and then you need a medication for the side effects of the first medication. And it's just this terrible, vicious circle for us, and, so maddening. So let's just talk about inflammation for a minute. And I understand, I actually have a hangnail in my toe right now, and I have an infection in my toe, and it's inflamed, it's red. At certain times of the day, I noticed yesterday, I thought, oh, it's throbbing. I need to pour some, hydrogen peroxide on it, or whatever. I'm trying to just get rid of that inflammation. So inflammation as a word is about being inflamed or on fire. But when we're talking about inflammation in the body, the inflammation we can't see, what is that all about? And is it dangerous to us?
So that's a yes and no question. A little bit of inflammation is needed for our cells to know where's the signal coming from? Where's the fire that we need to put out? So a little bit of inflammation is needed for us to survive, because then our body knows what to do. The problem in this day and age is we have inflammation that is not matched. It's not a yin and a yang. And so when there's just chronic inflammation, and that's when we see problems. And it's multifactorial as well. So we have to look at where it's coming from and why is it continuing to burn? What can we throw onto that fire to start putting it out? That root cause that we were kind of starting to talk about initially. And so unfortunately, what you're seeing with treatments for breast cancer are, one, medications that cause us to not feel well. Two, we really don't have a reason why people get muscle aches and pains. Like, I have a theory for what is going to make it worse, but to go back to the pharmacology of these medications, it's a side effect, but we don't know the true why if it happens. And I'll make it into another example is, why do some people, get muscle aches or what are called myalgias with statin or anti-cholesterol medications? I don't know when I see you for the first time who's going to have that. But we know that that's a possible side effect. So that's also a sign of inflammation, having that worsening of the inflammation. So it can be the food we eat. A lot of times when you get this diagnosis, think about it. I'm the only doctor that my patients look at me funny, where I'm like, when they get a diagnosis, I'm like, I know your friends are going to put a meal train together. Can you please, please, please put parameters on there? Because people want to know what you want, and they're going to think of comfort food. And I'm sorry, but comfort food, we as Americans want mac and cheese or casseroles or cinnamon rolls. Please don't have them bring those to you, because now we're going to create to this inflammatory state. So let people love on you. They want to, and they're not going to be offended when you say, can you please put these healthy items if you're going to bring something over? And if they want to, there's kids in the house or something, sure. If you want to let them get hyped up on sugar for once in a while, I'm not the devil. But when you're a cancer patient, when you are in the fight for your life, I don't want the treats at the time. I want to hit inflammation from every possible angle. So I want sleep, I want hydration, and I want good nutrition. And then we can even dive into this at some point. There are things that we can do to reduce inflammation as well and help support the other cells' health. Okay, so we have all these other trillion cells. And yes, the oncologist is only trying to kill the bad cells, right? But they forget to tell you that you got to support all the other healthy cells. That's really what's really, really needed here.
Well, that's actually a really good point. Yeah, why don't they say that? Yeah, what's going to make you feel better while we're trying to kill the cancer, right?
Yeah. And by doing some of those things, you might see the brain fog go down. You might see the joint pain go down. So they might not completely go away, but if it's more manageable, then we feel like a big winner.
I think I've read that inflammation actually can we say that it causes disease?
Yes.
Oh.
So the root cause of disease is oxidative stress. What is oxidative stress? It's inflammation. So if you want over 200 diseases, we know the root cause is inflammation, is oxidative stress. And that's the fire. I love that you had the analogy of fire. And so for some of us who don't have a good visual, what happens to an apple when you cut it in half, or a banana when you peel it? It browns.
So brown, right?
That's oxidative stress. That's aging. And that's happening in all of our cells. So as we age, that happens. And as we age, we are not as good at putting out that fire. So we have to do things we can do it naturally. I mean, that's when we talk about a healthy lifestyle, those are important. We need to do supplementation and activation of our cells.
So, okay, what are some of the things that we unknowingly do to increase inflammation in our bodies?
Stress. We forget about mindfulness. Yeah.
Really?
So I'm big about how do you meditate? How do you de-stress? How do you quiet down before bedtime? Those are actually really, really important factors. And I'll tell you personally, so one, I'm a believer. I always thought prayer was my quiet time. But two, I had my business coach before I made my practice or built my practice. He encouraged me to meditate. And I thought, well, I do that. I pray. And he's like, no, it's completely different. Completely different. He had me read a book called Becoming Supernatural by Dr. Joe Dispenza. Now, it was really, it was important for me because what that book showed was the importance of meditation and getting into a quiet space. And he proved it through all his scientific research, which I, as a medical doctor, needed to see that it wasn't it wasn't foo-foo, literally, because I thought, oh, my prayer life is my meditation time. No, completely different. And so that if those of you who like science, read that book. It's a little odd. You go through all these quantum things, but I think the overall idea is seeing what happened to someone's blood pressure, heart rate, what he measured hormone levels. He measured all of these things. So it was needed for me to see the scientific proof of what meditation could do and what breathing could do. I mean, and so think of Navy SEALs. They learn how to breathe before going into action. So
breathing is highly underrated, I think.
It is highly underrated. And so, I understood mindfulness, but those are really big things. I think that you've never heard from your doctor. You might hear it if you go to a counselor, but right. You never hear it from your doctor. And I think we're missing the boat there on talking about it with our patients. Mm-hmm. The importance of being mindful and having a good routine. I love oncologists, and they're in the fight to help you stay alive. They want to kill the cancer. I get it. And thank God for them, and thank God that we have the medicines to do that. But I think what needs to change from this point forward is, what do we do to that's more than just survival? Because I want to thrive in my life.
Same. Yeah.
And I know you want to thrive. So if I tell you, yes, I'm going to put you on a plan to kill the cancer and to keep you cancer free, but this is what I'm also going to do because I want you to thrive, not just survive. If we had that conversation, I think a lot of the brain fog, the inflammation, the side effects, we would see that percentage go down. And we would have women being active parts of their life instead of just surviving through this time, saying my year is up here, or my 3 years, or my 5-year mark, and then I'll live. Mm-hmm. I want them to live through all of this. And there are some cancer treatment centers that have that mindset, but a majority of them don't. And I love that you're having me on. And you've had other people on. There's more that can be done.
Absolutely. Yeah. There's a real gap in knowledge, I think, for the cancer patient as they kind of wind down from typical treatment. I just feel like we're standing there going, okay, now nobody's watching me. I'm freaking out because they said there's a possibility of recurrence. What am I supposed to do? What am I not supposed to do? I mean, it's like you just dropped like a hot potato. And I think that's the gap that we're trying to fill as much as we can. And thank God for all you beautiful experts that have joined the cause to educate our women about different things. Now it's up to our women to take what they learn here and execute it, to take this information to their providers, to incorporate the knowledge into their lives in a way that's that can have impact for the rest of their life. So yeah, I'm with you. I mean, I always thought from the beginning, I was like, survivor. I'm a survivor. I'm a breast cancer. It sounds like I got out of a plane crash by the skin of my teeth, and that's like it's not a good look for me. Yeah. So I'm definitely a thriver person. So that's good. And listen, our sweet Mets sisters have already grabbed that. So then, when you say you're a thriver, people go, oh, stage 4. No, it's not that. It's just a word. So yeah. So anyway, so that's good. Okay. So, okay, so stress can increase it in our bodies. What, food choices for sure.
Food for
Yeah.
sure. So unfortunately, if your audience hasn't heard the word SAD diet, it's the standard American diet. So it is very inflammatory. And so it does matter what we eat. If we go back to Hippocrates, let food be thy medicine and medicine be thy food. It's so important that we fix our nutrition, because our nutrition can be inflammatory. The other thing that's important, I think we had talked about this. Some people might have to do a food sensitivity panel because even they might, think that they're eating healthy, and they're just noticing that they're still bloated. They're having mucus. There are so many things other than just diarrhea and constipation that can tell us that there's a food allergy or a food sensitivity. So there's a difference. I'm going to go on a tangent. There's a difference between an allergy and a sensitivity. An allergy, we kind of really think is IgE meditated. Most doctors will do an IgE panel on you when you ask for a food panel. And that's usually hives and swelling. When we think of someone with a peanut allergy per se, that's the most common one. The anaphylaxis, or, big red swollen lips, trouble breathing, a rash, or if you have an allergy to penicillin. So that's different. There's also an IgG and an IgA type of sensitivity issue to certain foods. And so you can ask for one of those types of tests to figure out if we need to remove some of those foods. So like, let's say for me, it's a cashew. Cashew should be something healthy, right? But you give me one and I feel foggy brained. I get bloated and I just don't want to work out. And it's from a cashew. And so there are certain foods that we might be able to test for as a food sensitivity. Most common one, I think, is gluten. So many people are noticing they're gluten intolerant. Okay. They don't have celiacs, which is a true allergy. That's a disease. But a lot of people, when they take gluten out, they're noticing they're less bloated, their fogginess goes away, their joints are not hurting. So that's one sign of inflammation that could be caused from something you're eating. So the most common thing is your standard American diet to clean up. The second thing is maybe having to do a food sensitivity panel to see if there are other foods that we can reduce. But I'd say in America, for sure, it's dairy and wheat are the most common things. So that can be your poor man's test. Remove those for 30 days, see how you do, and then go from there. If you find out that, oh my gosh, I'm doing so much better, then don't pay to have the other testing done. If you're a little bit better and you're like, oh, I think there's some more, let's test you.
How interesting. So you said the sensitivity panels are IgG and IgA, is that right?
Yes.
But your doctor should know, your provider should know about those panels. Okay. And that's, I appreciate you telling us about the poor man's diet, or the poor man's test, right? That makes a lot of sense, that if you just do it and take it upon yourself to eliminate dairy and wheat, you'll certainly pay attention to how you feel, right? So very good. So food sensitivity, okay, you just said, I think, that it can come out, it can appear in your body in different ways. So you're saying constipation, bloating, mucus, you mentioned. What other kinds of things?
So the joints, joint pain,
okay,
foggy brain, dry skin. A lot of sometimes just changing food, people's skin responds a little bit better. Those are really the common ones, because I think we always associate it with the GI stuff, but there's so much more. Some people feel depressed too. They'll change their diets and now their gut's not inflamed, which they might not have the gut part, but serotonin is from our gut lining, the majority. So we remove the food, the serotonin increases in their gut. Guess what? The gut talks to the brain. Now the brain's happier.
Well, what a good segue that was not planned, my friend. Okay, I thought about this right before we started recording, and I didn't put it on our list, but let's talk about leaky gut for a moment, shall we? because that is it is super interesting to me. I don't think that people understand about the gut biome. I don't think, and hi, Jan James, not a medical anything, just a good researcher, and I love information. And so I know a little bit. I'm dangerous with what I know, but here's Dr. Mel, who is a trained killer professional. And okay, so what is leaky gut? Because I think it's so not diagnosed often. But I think if you talk to people, I'm going to have girls writing to me going, oh my gravy. Okay, let's do this. What's leaky gut?
I wish I could share my screen. I have a perfect picture of this that I teach patients with. So leaky gut is exactly what it sounds like. It's you have a permeability that's happening inside those bowel cells. So you have a lining from mouth to rectum. Okay. And that's called your microgut or your microbiome. And it has different flora from mouth to bottom because each species has a different function, whether it's digestion of your food, absorption of your nutrition, the making of vitamins or activating them. There's so many, your immune system, they all have a different function. But if you go into that small and large intestine, those cells look like almost like a hand. And then they have these little squiggly things, and then they're put together. So I like to show this to my patients. This is nice and tight. I don't want things to go in between. Okay. When there's a leaky gut, there's space and things that are supposed to take up here and decide whether or not they can come through. They're coming through. The other thing is the holes. There might be holes in these cells. There are certain cells that will line all of this as well, and they can come through. There's a test for leaky guts called, one of them is zonulin. You can see if you have an increase in your zonulin. That's kind of a test that not like SonoraQuest or LabCorp can do. That's kind of one of the specialty tests that we do. And we can test for other things, but leaky gut is real. So in the past, you'd get poo-pooed. I think I have a leaky gut, and now we have testing and we have pictures to prove that it's a real thing.
But let's talk about, okay, so like just think about those words to our podcast audience. Just think about that. So things are getting into places where they shouldn't get. And what is the outcome of that? What are the symptoms that we
inflammation
have? What? Shocker. Right?
Inflammation, because the barrier is not there to protect. So now things are getting into the bloodstream that are not supposed to be in our bloodstream, and that increases inflammation. The barrier has been broken. So prebiotics can help that barrier, and the type of prebiotic makes a difference. So how it's made, are they even going to survive the stomach acid? What kind of capsule is it in? All of those types of things. I could go on a total tangent. So that there's something called prebiotics. So most people have heard of probiotics, but they haven't heard of prebiotics. Prebiotics are the food for the probiotics. Most common, fiber. Okay. And then there's foods that help, like kombucha and sauerkraut and chicory root. And I mean, the list goes on and on. So fiber is a prebiotic. And then there's postbiotics. Those are almost what they're byproducts of, like, not all yeast is bad. So a lot of people go, ooh, yeast. I heard, no, I've had a yeast infection. I'm like, yes, there's good yeast and there's bad yeast. It's all about the balance. So, but these are all things to help with that barrier, trying to make it. So, the more antibiotics you're on, the worse if you're on a low fiber diet, if you're on an inflammatory diet, you're going to be breaking down that microbiome. You're not supporting it. And so you can have more of a leaky gut.
Oh, so here's okay, this is just, now I'm just talking to you about this, and listeners, just go with it, go with the flow. I had really debilitating brain fog after breast cancer treatment. Terrible. Greg, my husband, said, I know I told him, I said, I think, brain fog's coming on. He said, no, that can't happen. You're always at 100%. And I said, well, welcome to breast cancer. And I was really in trouble. I couldn't remember things at work. For those that have it, it's a terrible, terrible problem. And then as I started to research inflammation, and then I learned about the microbiome, and all of the things. So just think logically. This is the Jan James version. Hi, I'm not a medical professional. If you have things that are going in places where they're not supposed to go because the barrier is leaky, then it could happen, could it not, that things that are inflammatory are headed towards your brain. And is the blood-brain barrier leaky? I think I've read something about that recently, that they're now thinking there could be holes even in that, which could cause inflammation in the brain, which could cause the brain fog. I don't know.
Yes.
Oh, well, there you have it, ladies and gentlemen.
There you have it.
Well, good. I'm going to go get my diploma right now.
The short answer is yes. We're learning about that so much. And the gut-brain axis, where it was poo-pooed for so many years, is truly there. Our vagus nerve is from brain to tip of your tailbone, and it speaks. It's all over our gut, and it speaks. One of its main functions is telling our brain what's going on. And so it's really important for us to take care of our gut. And the biggest thing that we can do is change our diet, and add maybe some pre and probiotics, and healthy food. Then, there's other things that we can do to simmer it down depending on where somebody is at. There's a lot of foods that can be healing as well. Things that have polyphenols in them and things of that nature.
What are those?
So it's like, those are like they're mainly from your beautiful colored fruits, and your vegetables, like your cruciferous vegetables make something called sulforaphane. So that's your broccolis, your cauliflowers, your kale, your cabbage. That's actually anti-inflammatory. It's very good for our gut. Not only are you getting this fiber and it's having to really work through things, but guess what? Some people can't digest it. So this is where that food sensitivity or food journaling can really come in helpful. And then some people can't digest it until they start healing their gut. And then we can add those things in, and they don't get gassy, or they don't get upset stomach when they start to eat them.
Right.
There are some powders that some of us use that, like glutamine, is very healing to the gut, maybe licorice root. There are some really natural things that we can do to help with someone's gut healing.
Okay, so folks need to do their own research and then take it to their provider, as always, because we're not prescribing anything here, folks, but we're just trying to give you ideas about the direction to go. But I hope that you'll become a researcher for your own health as well. So, and even though I have the education, I'm not always up to the task of executing perfectly. For sure, I fail every day, but I think I understand so much more than I used to. So, even with a foggy brain, I was able to get to some answers. So I would really encourage you that are suffering in that way too, to do your own research. I'm always available to send me a message. I'm glad to chat through it. I love doing that with my girls. So that's awesome. Okay. So I'm just trying to see if there's anything else. Are we missing anything about what can help? Prebiotics can help. Let's see.
I'm going to throw out omegas. Omegas can help with inflammation. So eating more fish, know where your fish are coming from. I'm going to say, salmon is high in omegas, cold water fishes. You want them to be as much as possible free, not farmed fish, but like ocean. And I tell people to limit or never tilapia. It's a farmed fish.
Oh, really? Oh, interesting. That's one of my favorites. Good to know.
I know.
Interesting.
So, and you can take a good omega supplement. It's great for the brain fog. It's great for the joint pain. And where you get your omega makes a difference because it can be inflammatory itself. So you want omega 3s. You don't need omega 6s. Our food has enough 6s. And then if it tastes like fish and it's smelling like fish, it's oxidized. It's not a good brand. It's not good.
Oh, it
So
shouldn't smell. Okay, so an omega-3 would be a fish oil capsule, right?
yep.
But yeah, sometimes they can be stinky, so you don't want that. Are there brands that you suggest or not really?
Yeah, there's a couple. Like Metagenics makes one, Nordic Naturals. Trying to think here. Dr. Accord, I think, has one. There's several. So
Okay. I'll
but
get the links. Yeah.
you're looking for like seals of approval, third party validation on them. You want to make sure they're a sustainable, make sure there's no other filler type omegas in there, those types of things.
So fillers like omega-6s is what you're saying, because we don't need those, right? Yeah, I've read that before too. So that's awesome. Okay, great. So let's go back to where we started. So we were talking about just generically, are women having joint and muscle pain and sometimes brain fog too? Sometimes sometimes our poo-poo platter is full of all kinds of different side effects. But overall, what we're saying is, there are, I think, actually pretty simple things that you can do. Education is power. If you know what not to do, you're not going to be making the inflammation, and inflammation means pain to me. I mean, it does in my toe right now, but if you think about it that way, it's inflammation for your body is painful for your body as well. You may not feel it in the same way as a hangnail kind of thing, but so we're talking about all the things that we should avoid and all the things that we should do. Are there specific things that we should be asking for from our doctors other than those food sensitivity tests? How can we interact with our providers on that?
You can ask them to check some of those inflammatory markers, and then as you change your diet, you can see. You can actually ask for an omega index from your doctors. So Norquest and LabCorp can do an omega index to see where you are on that panel. Now, I'm not going to tell you all insurances will cover it, but it's a great test. And there are inflammatory markers that can be monitored. And as you change your diet, you can see if those go down. Unfortunately, most doctors have not taken a class in nutrition, or they might not have done like I did wound care, in hyperbaric medicine. So I had to learn nutrition during those classes and see what type of maybe IV drips I put my patients on. So that was extra training I had done. And so if your doctor has done those things, great, they can tell you, or if they have, I know some cancer centers have a nutritionist on staff that can help you with changing nutrition and maybe doing some of those testing. Otherwise, you might have to seek someone out to do that testing, and then maybe put you on an elimination diet and help treat that. And
what is an elimination diet?
That's when you do a food sensitivity panel, and then we put you on a special meal plan to help you rotate through meals during the 30 days or 60 days, so that we can help with healing your gut microbiome. And then we start to reintroduce certain foods and see how you respond. So the classic term for that is an elimination diet, then with a refeeding. So those are some things that you can do, and it's going to be seeking people who understand this and can really help through this. Because I don't like the answer of just take Tylenol or ibuprofen for the pains. There's a lot that we can do outside of it. There's natural anti-inflammatories that are out there. And the first thing I want to do is hydrate, sleep, and nutrition. Those are the cheapest and the most sustainable and actually necessary. It doesn't matter what disease we're talking about or goal in life. Sleep, nutrition, and hydration are always the cornerstone, in my opinion. And then, some natural anti-inflammatories like turmeric might help you, or if we're trying to detoxify, milk thistle. The brain loves alpha lipoic acid and L-theanine. I mean, you can kind of look up all of these types of ingredients and see where you might be able to get them out of foods, natural foods, like maybe incorporating more nuts into your,
berries. I know berries are super
berries.
Yeah.
And we talked about polyphenols earlier, the berries. And again, I'm going to ask you to go organic here because of the pesticides. Your body is more at risk when you're a cancer survivor and you were working at healing the gut. So look up the organic, what's it called, like the clean dozen and dirty dozen and foods, so that you're paying for the right things that need to be organic versus non-organic. That's really important. Things that are coming out of the soil or your berries, you kind of want to pay the extra money for the being organic.
Right. And just so you know, ladies, you can just literally search for anti-inflammatory foods. There's tons of information out there. So, you can go through those lists and go, gosh, well, I really like blueberries. I didn't know. So then, you're giving yourself a treat in addition to helping your body lower its inflammation levels. So everybody wins. We like those kinds of things. So that's awesome. Okay.
I forgot one big thing.
Oh, yeah. Tell us.
Alcohol.
What? Oh, yeah. This is a big deal for some people.
I challenge during this is no alcohol for 30 days. See how you do. And then try to pick cleaner ones.
Are there cleaner ones?
Mostly the ones that are not here from the United States.
Oh, geez.
I know. They have stricter guidelines to organophosphates and pesticides, herbicides, those types of things.
Oh, my goodness.
But I challenge everybody who's having brain fog and microbiome issues and joint pain, and we're talking inflammation. If you're saying, oh, I want my glass of red wine, it has resveratrol, take a resveratrol pill.
There you go. You're not known, I know, for saying take another pill, but in that case, right. Wow, that's interesting. Yeah. Oh no. I know the power of resveratrol too. It's that's an amazing supplement. So, all right. Well, you are just a breath of fresh air about everything. I always enjoy our talks. So thank you for explaining all of this to our women. I really hope that our women will plug in on this, because I think it is the root cause of so much of what's ailing them. And if they can get their inflammation at least decreased, I think life is better with that in mind, right?
It really is. It really is.
Yeah. Well, that's great. Well, okay, guys. Well, we're going to sign off for now. This is Jan James and our favorite Dr. Melody Rodarte out of Gilbert, Arizona, signing off for now. We will see you next time on the Hope After Breast Cancer podcast. Take care. Bye-bye. Hey there. Thanks for listening to our podcast. We love to encourage and equip our women to heal after their diagnosis and to give them hope. Please subscribe so you don't miss an episode. I look forward to seeing you next time.